Hello, this is Dr. Stanley Lang. Welcome to this video, and the topic is on vitamin K2 and kidney health. So I had a couple of patients recently that had experiences with kidney stones, and they have had these kidney stones for years and pretty much are resigned to having kidney stones. And so I mentioned that vitamin K2 could help protect against kidney stones. Now, how does this happen? Well, vitamin K2 is very different from vitamin K1. Years ago, it was thought that K2 was just a variant of K1, but it turns out that K2 does very different things. And vitamin K2 is actually a very complex vitamin. It's got multiple subtypes. There are two of the subtypes that are available as supplementation. And so because we in the West, particularly in the United States, have very poor vitamin K2 in our diets, we are susceptible to all sorts of conditions that are a result of vitamin K2 deficiency. For instance, heart disease is dramatically increased. Coronary artery disease is dramatically increased if you're K2 deficient because your arteries calcify more easily, and that correlates with heart attacks. Well, in the kidney, there's a couple of different places that K2 interacts with that we know about at least. And there's a protein that it interacts with that helps to push calcium away from crystallization in the kidney. And that's the process of kidney stone formation. So when that protein is activated, it's less likely that crystals made from calcium will start to form. And the other thing that K2 has been shown to do is that when it's in sufficient levels, it actually starts to reverse calcification of the arteries to the kidneys in people with advanced kidney disease. So it's a very critical vitamin. In my view, it's one of the most critical vitamins to supplement. It's one of three that I recommend routinely to all of my patients when I see them and talk to them about what can they do to help promote health, to try to reverse disease. There's a lot of other nutrients that can help in a complementary fashion, but K2 is particularly useful, and it's needed to make vitamin D safe to use. So you don't want to use vitamin D and without K2 being okay. And the problem is we can't measure vitamin K2 levels. We can only measure K2 activity indirectly. We know from these studies that most people in the United States are significantly vitamin K2 deficient. So the two forms that can be supplemented are abbreviated MK4 and MK7. And my recommendation is to supplement with both of them, not just the MK7 form, which is what is usually recommended by people that talk about vitamin K2 supplementation. Why is this? Because we really don't know which of the forms are the most important in different parts of the body. It's probable that all of the different forms are important, the MK4, 5, 6, 7, all the way up to 9, or even all the way up to 11, or even 13. And so those other forms are only going to be present in foods, but this focuses on supplementation. So my recommendation is a supplement with a high quality MK4 and a high quality MK7 in it when at all possible. Now, part of the thing that you need to look out for is that certain governments from overseas that don't have a lot of investment in quality control, certain countries, I should say, are dumping really junky vitamin K2 in the United States. And unscrupulous companies are putting this sourced stuff, and I'll say it's Chinese sourced, okay? They're putting that in bottles, labeling it made in USA, and it's not. And it's not good quality. And I won't get into all the details of why it's not as good as something that would be high quality American sourced vitamin K2. So by taking vitamin K2 supplementation, you can decrease your risk of kidney stones. If you have kidney stone issues, you can decrease your calcification of the arteries to the kidneys, and probably all of the arteries in the body. It just hasn't been studied that much yet. So how much should you take? Well, nobody knows. I've heard people talk about 100 micrograms as a dose, 180 micrograms. It's not based on any really good research at this point. My feeling is that when you've got active disease, you should be taking at least 300 micrograms and maybe all the way up to 1,000 micrograms. And this dose is safe. The Japanese have been using much higher doses of K2 for years for osteoporosis, and that's a whole different subject. But the point is, it's safe to take at least 300 micrograms a day. I would use the combined form of MK4, MK7, find a good pharmacy that is invested in high quality supplements rather than the big box stores where a bean counter is deciding what's on the shelf. So you want to make sure you're getting high quality K2. It's probably the most important vitamin to invest in when it comes to making sure you're getting the best quality, because if you're getting crappy K2, it's not going to do you any good. So I hope you found this helpful. If you want to decrease your risk of K2 of kidney stones, and if you've got kidney disease and you want to decrease the calcification in the arteries as part of that hardening of the arteries in kidney disease, K2 does help. It helps to reverse the calcification in the arteries, and it helps to activate the protein that helps to prevent calcium depositing into kidney stones. Now, that doesn't mean that you're going to have 100% success rate. There's other things to do besides K2 that are beyond the scope of this particular video, but the K2 is critical. It's critical for lots of things. In fact, it'll decrease your risk of heart disease dramatically, especially if you're doing the other things that are part of good heart health correctly. So I hope you found this helpful. God bless and have a great day.